ask one of them. Joining us now from Capitol Hill, Republican Senator Rand Paul of Kentucky. Good to have you on the show this morning.
Thanks for having me.
So, hey, Senator, what's the likelihood that you can be moved from the no column to the yes column? We had Chris Murphy last night saying that at the end you weren't going to be a problem. You'd cave into Republicans.
Well, you know, I want the bill to look more like a repeal bill. I promised people I was going to repeal it. I didn't promise people that I was going to replace it with a federal program of bailing out insurance companies. The fundamental flaw of Obamacare was that we said to people you can buy insurance after you're sick. And we also added regulations to insurance that increased the price of insurance such that healthy people didn't want to buy it because it was too expensive. Those fundamental flaws still remain. And the Republican proposal is, okay, you can still buy insurance after you're sick, which led to the death spiral, led to the elevated premiums, but we're just going to subsidize premiums by dumping a bunch of federal money into the insurance companies. My problem is insurance companies already make $15 billion a year. I don't think the taxpayers should give them any money. And so I really am opposed to the idea of giving insurance companies money and saying, will you lower your prices? I mean, we could do this for cars. New cars are expensive. We could have a new car stabilization fund.
Yeah. I could have used that like a couple decades ago. So, hey, so let me ask you this, Senator, and I'm going to pass it on to everybody else here. This is more of a where we ought to be instead of a where we are or where we will be during this debate. But at what point do Republicans or conservatives of all parties actually put together a bill that moves the health care system towards free markets? Because right now, the health care is extraordinarily expensive. We spend more money per patient in America on health care than any country on the planet. We don't get the results, and in large part, we don't get the results because the free market is kept outside the door of every hospital, of every doctor's office, of every testing facility.
You're exactly right, and I can summarize the healthcare cost problem in one sentence, and we don't address it. The one sentence is the reason capitalism doesn't work in healthcare is the consumer is disconnected from the product. Consumers do not make decisions based on price in healthcare, except for a few exceptions. LASIK surgery, when you want to get surgery to get rid of glasses, everybody asks the price. The average consumer calls 4 different doctors. It's a very sophisticated laser, $1 million laser, and yet the price has gone down by 3/4 over 15 years. Contact lenses, same way. When you connect the consumer and the consumer cares about the price, guess what? The consumer will shop, and when the consumer shops, competition works. But we're not really doing that in healthcare. Most of healthcare has fixed prices. Medicare, fixed prices. Medicaid, fixed prices. And even private insurance, no consumer shops for price. There's a little bit of competition in what prices come forward, but not really with the consumer involved.
All right.
Mike?
Senator, I want to read a letter to you that's in the New York Times today, written by Martin Platt from New York City. It reads, I would propose passing the Republican health care bill without amendment on the condition that all members of the House and the Senate be required to have health insurance as laid out by this plan and only by this plan for themselves, their wives, or husbands and their children. This would also apply to the President, the Vice President, and their families, as well as all members of the Cabinet and all federal employees. My question to you, sir, is would you and your family sign up for the bill as proposed right now?
Well, we currently have Obamacare, and we're mandated by law. I'm not sure the specifics of what will happen, but my guess is this will be binding on us as well. But no, I don't really want it because I want to be allowed to choose inexpensive insurance. In fact, one of the big replacement ideas I had was to legalize inexpensive insurance. But to get inexpensive insurance, you have to repeal the regulations. There's 12 regulations in Obamacare. We're repealing 2 of them. So we might be able to whittle the price down a little bit, but I don't think prices are going to come down at all. You have to let people buy what they want. Now, they're saying we're giving waivers to states, but what I'm hearing back is that many states won't accept the waivers. On the left, people say, oh, no, they're going to accept all the waivers and there'll be no protection. From the right, I'm worried that they'll accept no waivers and the price will still be sky high to buy insurance.
Senator Paul Donnie Deutsch, nice to chat with you. The other side of the aisle will call this as redistribution of wealth. Obviously, parties are given to hyperbole, but the reality, according to the Center of Tax Policy, is that 90% of the benefits in this plan go to families making $700,000 a year or more, the 1%. That is a fiscal reality. How do you explain that to some of the people, some of the elder people, some of the middle-class people, some of the lower-income people who are on the other side of that?
I think this is the same debate we get into anytime we want to cut taxes, and it's really a math problem, and people distort math to try to have partisan results. So, for example, the top 1% pay about 33% of the income tax. So the top 10%, those who make more than $200,000, pay 66% of the income tax. So if you have a flat tax, and it's sort of a math problem in the sense that if you cut taxes 10%, the person who makes $100,000, 10% is a bigger number than 10% is at $10,000. But we also have a tax code that most people on the lower end are not paying much. Gradually over time, we've taken people off the rolls at the very lowest end. So under $75,000 pay only 4% of the income tax. So really, it's disingenuous to say this is a tax cut for the rich. All tax cuts will benefit people who pay more in taxes before the tax cut. That's just a fact.
But it is a 4% tax cut as far as on investments in terms of payroll tax. It is a tax cut for the rich.
Well, what it is the rich pay more in taxes. And so anytime you have a tax cut, even if you make it equal across the board, and it's not like we're choosing people that have investment income. It just happens that this was a tax increase that was placed on the wealthy. When it comes off, it'll be a tax cut for the wealthy. But the thing is the wealthy pay the taxes. So any tax cut, even if it's equal in percentage across the board, will always benefit those who pay more in taxes.
Senator Paul, it's Willie Geist. Good to see you this morning. As you know, the Medicaid expansion is widely used in your state. It's popular in your state, and you have valid concerns about how your state pays for it. Maybe you'll have to raise the state income tax to keep up with that. But as you know, once you give someone a benefit like that, it's very difficult to take it away. So what do you say to the people in your state who are worried that if this becomes law, they will no longer be covered by that expansion of Medicaid?
I think we should have an honest debate about how we pay for it. And so if you say the federal government's going to pay for it, it's very easy because the federal government has a printing press, you know, down at the Federal Reserve. They'll just crank out, we'll add to our debt. So we have a $500 billion debt every year. So saying that the federal government's going to pay for it really is not honest. So what I tell people is if we want Medicaid expansion in Kentucky, Kentucky ought to pay for it. And everybody realizes that we can't even pay more than 10% of it. And that's true of most states. So Obamacare did a sleight of hand. They said, oh, it's free. You don't really have to pay for it. We're just going to send it to the federal government. But if the states had to pay for Medicaid expansion and it were honestly done, states would have to raise their taxes, and then legislators would make really honest decisions. Do we raise taxes with the possibility that people will leave our state for business? Right. See, Kentucky sits right next to Tennessee that has 0% income tax, and then in Kentucky we have 6%.
Right.
If we want to pay for Medicaid expansion, we'd probably have to have a 12% income tax, but we might lose business. So there would have to be a trade-off.
I understand the trade-off there, but real quick, what happens to those people then if this becomes law? They're on Medicaid now. What happens to them?
Right. What I would like to do is legalize inexpensive insurance, and you should be able to get insurance for $1 a day. I mean, you really should. The insurance companies make all the money. All of this is predicated upon still, propping up the insurance companies. The insurance companies hate the idea of the buying pools where you could join an association, drive prices down. They absolutely hate it because they think it might eat into their profit. They love sort of privatizing their $15 billion a year profit, but then socializing their losses in the individual market. I have absolutely no sympathy for the insurance companies to be bailed out by the taxpayer. That $15 billion in profit, that's where the risk should come from. That's where when we have to absorb risk when people get sick, it should come out of their profit. It shouldn't come out of the taxpayer's pocket.
All right, Senator Rand Paul, thank you very much for being on the show this morning.
Appreciate it.
And just ahead, we're going to hear from Republican Senator